Hi, I'm Pelin and I will explain pain suppression and transcutaneous nerve stimulation. But before giving any details about transcutaneous nerve stimulation, it is necessary to briefly explain what pain suppression is. Pain is interpreted and perceived in the brain, and sometimes a painful stimulus from the outside, sometimes disruption in the internal organs, and sometimes unexplained pain can manifest itself in the body. The gate control theory, which is the first pain modulatory mechanism, was presented in the mid 1960s by Melzek and Wall. The gate theory indicates that at the spinal cord level, non-noxious stimulation will produce presynaptic inhibition on dorsal root nociceptor fibers, and this presynaptic inhibition will block incoming noxious information from reaching the CNS. To give an example for clarity, nerve currents unrelated to pain compete with pain currents trying to reach the brain. This competition creates an abstract neural gate that limits the number of currents that can be transmitted. That is, the person rubbing the aching area increases the number of non pain related currents and reduces the passage of pain related currents, and as a result, the sensation of pain is reduced. The gate theory just describes the general explanation for the idea behind transcutaneous electrical nerve stimulation for pain relief. A TENS machine or nerve stimulator consists of a typical battery operated electrical impulse generator and two or four electrodes attached to it. Although these electrodes come in diverse sizes and shapes, in general they are like skin surface electrodes used for monitoring biopotentials. Once the electrodes of TENS are attached to the skin, they work in three different ways to stimulate pain causing mechanisms and as a result suppress pain. It prevents the transmission of pain signals to the brain, it stimulates the production and release of endorphins, and also it improves blood circulation. The features that distinguish TENS currents from each other are waveform, pulse duration, pulse frequency, whether there is a pulse, burst duration, and current intensity. The TENS waveform can be symmetrical, asymmetrical, monophasic, or biphasic. The pulse duration is generally between 50 to 400 microseconds. According to the gate control theory, the electrical currents given by TENS stimulate the A beta type sensor nerves under the skin. This reduces the transmission rate of the signals of the C type nerve fibers carrying the pain sensation from the spinal cord to the brain. A beta nerve fibers are mostly stimulated by currents with a frequency of 90 to 130 Hz. Therefore, the TENS current frequency is mostly in this range. A delta nerve fibers are activated to use the endorphin release mechanism. First, electrodes are placed on the appropriate area while the device turned off. It can be placed on the skin of the painful area or it can be placed on the acupuncture points that match the distribution of the sensor nerves. The distance between the two electrodes should be at least 2.5 centimeters. After the electrodes are placed, the device is operated with the lowest current power at first and slight tingling is felt on the skin. The intensity is increased until the current is felt strongly but not disturbingly. TENS can be applied in different flow patterns according to the characteristics of the pain. Treatment time can vary from 15 minutes to several hours. TENS can be used to help with many types of chronic pain, and some of which are arthritis or other joint pain, back and neck pain, muscle pain, neuropathic pain, spinal cord injury, sport injuries, and labor pain. It is a safe treatment that often does not cause any side effects, but sometimes pets used in the treatment can cause allergies. In this case, non allergenic pets can be used. It's not applied on the abdomen during pregnancy, and it shouldn't be used without the advice of a doctor in epilepsy and heart failure conditions. There is not enough good quality scientific evidence to say for sure whether TENS is a reliable method of pain relief. Healthcare professionals have reported that it seems to help some people, although how it well works depends on the individual and the condition being treated. And that was all you need to know about TENS. Thank you for listening.